This is Tylonia McGinister, a 24-year-old woman who was involved in a motor vehicle accident. Tylonia is lying on a stretcher with a cervical collar and head immobilizer. The oxygen mask is placed away from her face, indicating it may have been temporarily moved during the initial assessment. Tylonia is being wheeled into a more specific treatment area, likely for advanced imaging or to a trauma room. The medical team is moving with urgency, checking for any serious injuries. An initial examination was completed and no serious injuries were detected. As work continues on Tylonia, the gradual uncovering of her feet ensures that medical personnel can efficiently perform ongoing monitoring and necessary procedures without additional movement or adjustments. Initially, her right foot is exposed and a medical worker tucks a sheet in between her feet, partially uncovering her left foot. Later, the top of Tylonia's right foot is partially covered while the bottom of her right foot remains exposed. The repositioning may have been done for practical reasons, such as to stabilize the sheet or improve her coverage, while ensuring that equipment or monitoring devices were still accessible. Tucking the sheet between her feet can help limit unnecessary movement of her legs and feet, especially if her condition requires her to remain stable. Sheets are often adjusted to ensure a balance between maintaining the patient's overall body heat and allowing exposed areas like her feet, to remain accessible for examination. Feet are commonly used to monitor circulation, swelling, or other signs of perfusion. Tucking the sheet in this way keeps her feet easily accessible while still offering partial coverage for modesty or comfort. Tylonia's feet appear to be at a natural resting angle, typical when a person is lying on a flat surface. In a natural resting position, the feet tend to fall into a slightly plantar flex state due to muscle relaxation. Based on the visual cues, Tylonia's feet seem to exhibit minimal dorsiflexion, if any, as the toes are not sharply angled upwards. But while visual-only methods have limitations, her feet are resting approximately between 25 to 30 degrees plantar flex relative to the horizontal plane of the stretcher. Estimating the size of Tylonia's feet is possible by comparing her feet to objects of known size, such as the hospital bed. However, it's important to note that this method will provide only a rough estimate due to limitations of perspective and image resolution. Based on the visual proportion, Tylonia's foot length can be estimated to be around 9 inches. This places her in the range of an average adult female foot size, which typically ranges from about 8.5 to 10 inches. Based on the estimated foot length of approximately 9 inches, Tylonia's shoe size would likely be around a U.S. women's size 8.5 to 9. This is an approximate conversion, and actual fit can vary slightly based on shoe brand and style.